Welcome to the PD Pet Care Vlogs. I'm Dr. Cath Watson, and today we're going to cover off BOAS. This may or may not be a term that you've come across before, but BOAS, so B-O-A-S, stands for Brachycephalic Obstructive Airway Syndrome. It typically affects flat-faced breeds, otherwise known as brachycephalics, so that means short nose. These are dogs like pugs, Boston Terriers, French Bulldogs, English Bulldogs, but also includes the likes of Staffordshire Bull Terriers, which maybe we wouldn't typically think of, but they definitely have still a shorter nose than your typical longer nose breeds like your German Shepherds and so on. So why is BOAS a problem? Well, it's really in that title, Obstructive Airway Syndrome. So it's a collective of problems that essentially add up to causing difficulty for the dog to breathe. There are a number of areas of physical areas of the dog that can be affected that can lead to this problem. So number one is the nares, or the nostrils. So if you've ever tried putting a peg on your nose and a straw in your mouth and going for a run, so I don't know if you've ever tried it, but maybe it's worth it for you. Just try sitting with your nostrils pinched, with your fingers is fine, or maybe a peg, and then just sitting around the room, probably not affecting you hugely, but then just get up and do a little bit of walking around or even a little bit of a jog around the room. At this point, you're not allowed to open your mouth and pant because the rest of your airway should be functioning pretty well. It's just to give you a demonstration of what happens when those nostrils are really narrow. So really narrow nostrils makes it much harder for air to get into the rest of the airways. Yes, they can open their mouths and breathe, but we'll come to that later. There's other obstructions there as well. And in general, dogs would prefer to breathe through their nose because that's where all the olfactory senses are. That's where they get to pick up all those smells that tell them what's going on in the environment, basically like reading the news. So having really narrow nares is a problem for BOAS affected dogs. Then we move on to the nasal passages themselves. So bear in mind we're already narrow here. Inside your nasal passages you have turbinates, which are basically little protuberances of bone that are aimed to help flow air through the nasal passages in an efficient manner, but also managing to mop up all that debris from the environment, so dust and contaminants and so on. In some cases those bony protuberances are deformed and actually interfere with the airflow. So instead of coming through smoothly to the back of the throat, it doesn't. It becomes very turbulent, which obviously makes it harder to breathe as well. Moving one step further back, then we've got the palate. So our soft palate is the piece of tissue at the back of your throat, so between your nose and your mouth, that actually helps separate the nasal passages from your oral cavity. And at the back it is literally just a shelf of tissue. In BOAS affected dogs, because everything's been scrunched up, often that tissue is not only longer than it should be, but also often thicker than it should be. And that can end up interfering when it comes to actually breathing and opening the airway, so the big airway in your throat, the larynx. And when those laryngeal cartilages open up, sometimes that bit of soft tissue from the soft palate can actually get sucked in. So it would be a little bit like trying to swallow a blanket at the same time as breathing. Not a very effective way of getting air in. The larynx itself can also be affected. So particularly over time when you've got narrow airways from the nostrils, the nasal turbinates, potentially the palate, that are causing obstruction of airflow coming in, that's putting quite a lot of pressure on the larynx and ultimately it can collapse. What the larynx is meant to do when we breathe is that those cartilages, there's two cartilages there on each side, they're meant to open up and create this big hole where the air can go into our lungs. But when the larynx has been damaged by too much pressure, then it might be that one of those sides doesn't open, so instead of having a nice big round hole, we've got a one side that's collapsed and even getting sucked in, so it's narrowing that hole. In worst case scenario, both sides. So when you're trying to breathe in, you've got a gap. that's as thin as a piece of paper. Not much air gets through there. Obviously that's a pretty scary position to be in because essentially you can't breathe. Moving down from the larynx, we have the trachea or the windpipe. So that's that big cartilage tube that runs from our throat down to our lungs. Big airway. Well, it should be a big airway. What's happened with some BOAS affected dogs is actually that tube has got much, much smaller than it should be. So again, much less efficient movement of air into the lungs. And finally we come to chest deformities. So this is the sternum and the ribs. Obviously depends on the size and shape of the dog. Some can be very barrel chested, some can be much flatter chested, but either way the sternum should run in essentially a straight or curved line. There shouldn't be big upwards inflections heading into the chest or even outwards from the chest. And sometimes rib deformities can end up changing what that chest cavity actually, the amount of space it actually has. So all of these factors can individually contribute to BOAS, but often, or more often than not, in the severely affected dogs, so particularly English bulldogs, French bulldogs, pugs and so on, there'll be multiple components to that. So they may have a narrowed windpipe, as well as very small nares, as well as changes to the nasal terminates, as well as a long and fat soft palate that ultimately leads to laryngeal collapse. So all those things added up, you've got a dog who is noisy when they're breathing, often snores, struggles with exercise, or if they do manage some exercise, it's often very short-lived, and then they spend a lot of time panting. And these dogs typically will breathe with their mouth open almost all of the time, or if they do breathe with their mouth shut, then often you can hear them breathing, and we shouldn't be hearing dogs breathing, particularly at rest. So what's the treatment for BOAS? Well, it's complicated because in some cases there's not very much we can do at all. Number one, to help them breathe better is not to be carrying too much weight. So we want to keep these dogs in ideal body condition score or even slightly underweight, just so that there's less work that their body has to do to actually physically carry that weight. But obviously if you are carrying a little bit of extra weight, that means a little bit of extra fat, and some of that fat can end up in places like the back of your throat, like your chest. So that's reducing the capacity even further for those dogs. When it comes to surgery, we can certainly do surgery on the nostrils in particular. Really worthwhile considering when your dog is young, because opening up those airways as soon as possible is going to reduce some of the downstream effects. There can be surgery done on the palate to make it shorter and less fat. For a collapsed larynx, there is the possibility of doing surgery, although it does come with some complications. In a worst case scenario for dogs that are really struggling to breathe, we can do a tracheostomy. So that's essentially making a hole in the windpipe and providing an external access that avoids all those obstructions upstream, so the larynx, the palate, the nostrils and the nasal passages. Tracheostomy really is an emergency procedure. It is not something we would want any dog to live with long term. The risk of choking on mucus and so on is pretty high, and it requires some pretty intensive management at home. Definitely an emergency procedure. Let's try and not get there. So what can you do to avoid getting a dog with BOAS? The first thing, because I know these dogs are really popular, your Frenchies and Bulldogs and Boston Terriers and Pugs and so on, they are really cute and we're highly attracted to them, but we have caused this problem through our breeding of these dogs, and we need to take responsibility for that. And first step in that is recognising that BOAS is a problem and doing something about it. So how can you find a good breeder of these dogs? Well, my first recommendation is to go to Dogs New Zealand, that's the New Zealand Kennel Club, and find a registered breeder. If the breeder has gone to the effort of registering their dogs with Dogs New Zealand, then they're going to be following the code of conduct guidelines that are required of them there. And one of the new things that has come in for breeding of BOAS affected dogs is that they have to undertake respiratory function testing. So this is making sure these dogs that they're breeding are actually capable of having a reasonable ability to breathe, with the aim of trying to reduce the BOAS effects over time. So talking to a breeder, they should be able to explain to you what BOAS is, and they should be able to explain to you what they are doing to minimise the effect in their dogs. I'd be very wary of any breeder that says their dogs are not affected unless they can actually show you testing from the respiratory function tests that have been done on their dogs. Because yes, there are some dogs out there that are very good, but there's a lot of dogs out there that are marginal and we could see improvement in. So going for a registered breeder through Dogs New Zealand, making sure that they've done the respiratory function testing for the parents of any puppy that you want to purchase, or if you're purchasing an older dog, then making sure they've had respiratory function testing as well, so you're aware of what those complications could be. And the other thing I would recommend obviously is getting a signed contract with the breeder and make sure you understand what their obligations and your obligations are should BOAS symptoms develop in any puppy that you get. There is no doubt everyone finds these dogs really cute that are affected by Brachycephalic Obstructive Airway syndrome, but just remember it is in the name there. It is an obstructive airway syndrome that makes it difficult for them to breathe. We need to do everything in our power that we can to make sure we are not bringing more of these dogs into the world who are struggling to breathe, but are doing our best effort to make sure that we can have these cute and cuddly, awesome pets and companions that can breathe properly as well, and therefore have a normal life that doesn't come with respiratory distress.